I was diagnosed with lung cancer 4 years ago, and it was small cell lung cancer, which is not a particularly good one. And at the time, it was like being hit with a sledgehammer. I really expected I was going to be dead in a month. But the support I've had from Maggie's and the lung cancer support group gave me hope, and it changed everything. And I'm still here 4 years later.
And I was diagnosed 10 years ago with stage 3, just below stage 4 actually, non-small cell lung cancer, commonly associated with smoking. I went because I'd just retired and I'd had a cough for about 3 or 4 weeks, and I kept thinking, oh, I'll wait till I retire. And I went and I'd retired, and 2 weeks later I got the diagnosis of lung cancer. And the diagnosis that encouraged me to go to the GPs with all the publicity at the time around if you'd had a cough for more than 3 weeks, which I'd had. And I'm glad I went when I did, because any longer and my chances of survival, well, they were rapidly going. I think this is just an amazing idea, the lung targeted health checks, and really they've been a long time coming, because it really gives you a very clear opportunity to look at symptoms that you might have, like breathlessness, coughing, losing weight, chest pain, etc. Lots of very clear criteria.
I would say absolutely go. When I was diagnosed with lung cancer, I had absolutely no symptoms whatsoever. And I went for a lung health check because I was advised that, well, if there was anything, it would be discovered early, and that would obviously be better. So yeah, I think people should go, but I think we've also got to take into account people don't always have symptoms.
Yeah, my symptoms was just a cough. Julie didn't have any.
I had none whatsoever. So, I mean, it was a complete bolt out of the blue.
Yeah. I was a smoker. I'd been a smoker for a long time, but I'd actually given up 20 years before I got my diagnosis. And all I will say is that when they told me I got lung cancer, I felt so ashamed, because the first thoughts in my head was, I brought this on myself because I was a smoker. I've completely sort of changed my thoughts about that now. And I think that's the main thing that can stop people from going to try and get an assessment and a diagnosis, is because of the shame and the stigma around smoking. But believe me, I have never once experienced any adverse reaction from any professional that I've ever dealt with. Smoking has very rarely come up. And if people are still smoking when they go for the targeted lung health check, please still go. You know, you will be encouraged to try and stop smoking. But again, it's done in a very kind and compassionate and sympathetic way. But I would say, even if you're still a smoker, please still go. Don't let that stop you from getting a diagnosis that could ultimately save your life.
And I'd like to say that I think even if you're diagnosed at a late stage like I was, don't think it's a death sentence. I was told at the time only 1 in 5 of us would get to 5 years. I'm at 4 years now and I'm thriving.
Yeah, we're not just survivors, we're thrivers.